Each form of anthrax has its own range of symptoms. For most forms, the symptoms appear within a week of exposure to B. anthracis, but the symptoms of inhalation anthrax can take over a month to develop. Cutaneous anthrax. The most common form of anthrax is cutaneous anthrax. The symptoms are as follows. Small itchy blisters or bumps, a painless swollen sore with a black center swelling in nearby lymph glands and tissue. This is considered the mildest form. With treatment, it is rarely deadly. Without treatment, it may be fatal in 20% of cases. Gastrointestinal anthrax. This can come from eating raw or undercooked meat from an infected animal. The symptoms of gastrointestinal anthrax are abdominal pain and swelling, diarrhea, fainting, fever and chills, flushing face and red eyes, headache, loss of appetite, nausea and vomiting, sore throat with painful swallowing, swelling of neck and neck glands. Without treatment, half of patients die, but with treatment, 60% will survive. Inhalation anthrax. The initial symptoms of inhalation anthrax are chest discomfort, coughing up blood, nausea and vomiting, pain when swallowing, flu-like symptoms. As the disease progresses, the individual is likely to experience breathing difficulties, low oxygen in blood, meningitis shock. This is the most deadly kind of anthrax. Without treatment, it is fatal in 85 to 90% of cases. Injection anthrax. This has affected people who inject heroin in Europe, but it has not been reported in the US. The initial symptoms of injection anthrax are abscesses in and around the injection site, blisters and bumps around the injection site, fever, a swollen sore near the injection site. As the disease progresses, the following may develop: meningitis, organ failure, shock. The effects probably depend on how deep they are, but symptoms can also be confused with those of other infections. Tests and diagnosis. Anthrax shares many symptoms with more common conditions, such as flu and pneumonia. A healthcare provider will rule these out first before considering anthrax, unless there is a specific reason to suspect it. If other conditions are ruled out, then tests specific to anthrax may follow. An anthrax diagnosis can only be confirmed by measuring antibodies or toxins in the blood or other tissue. The type of tissue sample and other types of test will depend on the suspected form of anthrax. Tests include a skin biopsy to test for cutaneous anthrax, stool testing for gastrointestinal anthrax, chest X-rays or CT scans to detect inhalation anthrax, lumbar punctures to reveal anthrax, meningitis. In 2014, researchers that a glow test can detect the presence of deadly anthrax bacteria in hours instead of days. This could significantly cut the time it takes to respond to a potential bioterrorism attack. Treatment. Anthrax must be treated as quickly as possible before the levels of toxins and harmful bacteria within the body become too high for drugs to eliminate. The standard treatment for anthrax is with antibiotics and antitoxins. The type of antibiotics will depend on how the infection occurred, the individual's age and medical history. Antitoxin therapies are currently being developed that target the toxins released by B. anthracis, rather than the bacteria themselves. Recently, surgical removal of infected tissue has been used successfully to treat injection anthrax. In 2013, a team of researchers discovered a new chemical compound from the sea that could be used to treat anthrax and MRSA. Prevention. Tips for avoiding anthrax include only eating meat that has been suitably slaughtered and cooked, avoiding contact with raw animal hides, especially those of cows, sheep, and goats. People who work with fur, hides, and wool, especially if these are imported, should take extra care. Anthrax molecules are made up of 3 proteins, none of which is toxic on its own. It can be present in imported animal products. If anyone is exposed to the bacteria, antibiotics can prevent the symptoms of anthrax from developing before the B. anthracis spores have time to activate. The U.S. Food and Drug Administration (FDA) have approved a vaccine for anthrax, to be used prior to exposure by adults who could be at risk. These include laboratory workers, handlers of animals and animal products, and some military personnel. It is not available to the public. The vaccine can also be given after exposure, alongside antimicrobial therapy. Anthrax remains rare in the US. If a person has symptoms that resemble anthrax, it is most likely a more common illness. If a person shows signs and symptoms after exposure to animals or animal products from parts of the world where anthrax is common, however, it is best to contact a health care provider. To be effective, treatment for anthrax must begin as soon as possible. You like the video? Kindly subscribe in this channel. Babytime FYI. Thank you.